I am Dr. Tofte, family medicine physician at Grand Itasca. I see all types of patients, so kids, grown-ups, elderly people, pregnant patients, men, women, all ages. So sleep is important because a lot of things happen during sleep that our bodies rely on. For kids in particular, a lot of the learning that they do during the day gets imprinted in their brain and new pathways develop. Sleep is important for your immune system to function properly. So a lack of sleep can really affect kids' moods, their ability to concentrate in school, their physical health, and their immune system. Whenever I have parents that tell me their kids are just really emotionally labile, sometimes I really want to pay attention to how much sleep they're getting, because oftentimes those kids just need a little bit more sleep. The amount of sleep a child needs depends on their age, and there can be a range within that age. So typically preschoolers, we think of about 11 to 13 hours of sleep. Elementary school kids are closer to 9 to 11 hours of sleep, and then high school kids probably need a little bit less, but still need a lot more than kids are getting, so between 8 to 10 hours of sleep. To help your child develop good sleep patterns, I usually recommend looking at what time they need to wake up in the morning and then counting backwards the amount of sleep that they need, and really paying attention to that hour before they go to sleep as a time where they're gonna wind down and focus on getting ready for sleep. Your body doesn't just automatically fall asleep, and I think most adults realize that too, and your body relies on the light levels in your environment to produce melatonin, and that's your body's signal that it's time to sleep. And so really paying attention to that hour before bedtime when you maybe have the lights lower, really avoid screens in general. For some kids, I think bathing can be helpful. For some kids, reading or being read to can be very helpful, but having more of a quiet, consistent routine at bedtime is really important. I think it's pretty common for kids to have a later bedtime during the summer, and a lot of that just depends on what time they have to get up and moving in the morning. But if you have a child that wakes up pretty early in the morning, you still want to be very consistent with bedtime. And it probably is going to be light out when they need to go to bed. And so still, I think routines are just so important, and trying to block light from their bedroom. All of those things are going to be helpful in helping them fall asleep. Getting kids back to a regular bedtime in the fall can take a little bit of planning, and you probably want to have them going to bed about 15 minutes earlier per night for, depending on how many adjustments you have to make maybe that week before you get them back to school. Just like bedtime routines are important, I think routines during the day can be very helpful. It's really important that kids are getting physical activity. That can help them have more consistent sleep at night. A healthy diet is important. For older kids that have a tendency to sleep in or maybe sleep most of the day away, sometimes having an activity or responsibility or job that starts mid-morning can be really helpful to get them up and moving. Knowing that the normal sleep pattern for teenagers typically is later at night into the mid-morning. That's probably when they're getting their best sleep, so it's not all bad that they're sleeping in a little bit. So a lot of parents will ask me about melatonin supplements for their kids, and historically I would say that that's probably something to try, and it still might be helpful to try to get kids to reset their bedtime routines, but it is still a hormone, and some of the newer research is suggesting that it can affect the development of children's hormonal systems, and so I think you have to be careful about it and really only use it as a temporary measure while you're really trying to get some of these other schedules and routines in place. Working on breathing exercises with kids during the day can give them some tools to help them relax at night that wouldn't involve having screens in their bedroom, and that can be a very powerful tool for helping kids rely on themselves for getting relaxed and ready for bed. Grand Itasca Clinic and Hospital, your partner in health.